My name is Allison Cochran, and I will be presenting my paper for you today. Care Coordination Presentation to Colleagues. Good morning. My name is Allison Cochran, and I work on the nurse case management team at my local hospital. Today I will go over a care coordination presentation that I have prepared and just go over some basics. We will talk about how case coordination helps the patient and the families as a whole, and what a case coordination plan is in general. We will also examine ethics in nursing guidelines and how they can impact care coordination. Hopefully something new is learned today from this presentation that I will be giving to you. Care coordination is the main part of case management process, and it is needed to implement a care plan to help make sure that there's a smooth transition from one healthcare facility to the next. I like to think that the coordination of care is a team job, and we use a holistic approach with the help of different disciplines. The different disciplines increase patient care outcomes because the patient education, the needs are more and more precisely addressed with different disciplines as well. It also determines the individual needs of the patient and their family. This interdisciplinary teamwork ranges from doctors, pharmacists, therapists, nursing assistants, social workers, and non-clinical staff. Other outreach organizations may be called on as well to assist in improved patient outcomes. We have to help navigate the healthcare system and ensure the next steps for care are effortless for the patient. The Patient Protections and Affordable Care Act fostered a movement from a heavy focus on acute care to an emphasis on preventative health and disease control. Also, we should look to move forward from silos of practice to professional team-based care, where you can distance from fee-for-service. Pay-for-services are more motivated by quantity of care for incentives. If higher quality of care is received in outcomes called value-based purchasing, and to development of accountable care organizations. This shifts focus on population health management, all the while using the best evidence-based practice for guidance with our populations. What is the importance of care coordination? A way to improve a patient's access to healthcare is effective coordination. Compliance can also be boosted through means of education, also taking coordination. In 2017, there was an article written that quoted Dr. Botsford. To attain proper care, physicians must ensure patients understand their physician's medication orders and address patient-centered discharge planning based on the patient's risk level, condition, and ability to self-manage. One of the most important reasons case coordination is so important is Hospital Readmission Reduction Program. The HRRP is a policy that does not reimburse hospitals when they discharge patients, and the patients are then readmitted with the same diagnosis within a certain time frame. This policy was implemented in hopes to reduce the frequency of readmissions by means of linking payment with quality of care found. This information can be found at cms.gov site, the website. The Hospital Readmissions Reduction Program puts an emphasis on excellent care coordination and communication efforts to empower caregivers/patients by the means of engagement in their care after they discharge. What are the elements of care coordination? Well, there are multiple elements to care coordination. Easy access to a range of healthcare services and providers, good communications, and effective care plan transitions between providers, a focus on the total healthcare needs of the patient, and clear and simple information that patients can understand. A discharge packet should include all of the following. It should include frequently asked questions for medications prescribed, follow-up appointment date and times, and educations on their diagnosis, along with their doctor's address and phone number. A medication page with new and old medications starting times and when the last doses were given, and when the next dose is due, clearly written out to avoid any confusion. This will improve patient care outcomes and rates of compliance within medications administration. According to NEJM Catalyst, acute care coordination, post-acute long-term, and primary care coordination are all coordination types. Primary is exclusively to chronic diseases and management. Acute is for emergent health issues. Care coordination in the acute setting requires continued organization of daily care. Patients that are residents of the acute/long-term care facilities would be categorized as rehab, long-term care, or post-acute care. Ethics and coordinated care. The Code of Ethics for Nurses, per the NRA, contains 9 distinctive provisions. The first one being nurses must practice with deference, empathy, and natural dignity, worth, and unique characteristics of every person. Provision 2 touches on the nurse's main responsibility, the patient. Provision 3 states that every nurse has a responsibility to advocate for their patient, protect their rights, and promote healthy practices. The fourth provision consists of responsibility, accountability, authority for practicing nursing, and then lastly, making decisions about care. Provision 5 is more about the nurse for themselves, to take care of themselves and their health, and the same duties to others as to themselves. The responsibility to promote health/safety and continue to grow professionally in their career and in their personal life. Number 6 is for the nurse as well, both as an individual and a group collectively. This aims to advance the setting of the workplace, also making quality care that is safe and effective. Number 7 consists of encouraging nurses of all disciplines to challenge themselves with research and academic inquiry, development and specialized standards, and generations of nursing and health policy. Provision 8 is all about protecting human rights. To do these, nurses have to collaborate with different healthcare professions. 8 is also about decreasing the health inequalities seen and endorsing health diplomacy. The last provision, Provision 9. This provision addresses the nursing community as a whole, making clear to maintain the integrity of the profession. The nurses must articulate nursing values. Also, it calls on nurses to incorporate social justice into health policies and the practices of nursing. Family. Very rarely does a patient not have family around to help with their post-discharge plans. If a patient does not have a family member, there are other options like a friend, a neighbor. Then we have programs that we can also dispatch from the hospital, such as home health, physical therapy, OT, just to help the patients out. But since most patients do have a support system, it is important for better patient outcomes that you include their support system, whoever it may be, in the discharge planning. Ideally, the discharge planning and education should be written down simply and clearly when it comes to administration times for medications, times and dates for follow-up appointments, and the treatment plan moving forward towards the follow-up appointment. Thoughtful conversations about responsibilities, including for one's health or that of a family member, are important. The professional case manager, who can address each situation and explore networks of support, as well as what's available in the client community, can educate and empower the client and his or her system to make informed decisions. So, in conclusion, there is deemed a care coordination in this day and age more than ever. The need for it has increased. When there is monetary value associated with patient care outcomes, we have to work cohesively as a team and collaborate with different disciplines. Together, we can maintain better patient outcomes. Education is just as important as communication in transitioning patients from the hospital to their home and/or long short-term care facilities. Educating the family about support systems and available help will ensure that an informed decision is made. All options are explored. And a nurse should be prepared to talk in simple terms that the patient and the family can understand, go over a medication list and explain why there are prescribed medications and connect it to the diagnosis. Care coordination is a continuum. It does not suddenly stop when the patient leaves the facility. There are still follow-up appointments that need to happen, and at these follow-up appointments, we reinforce the education that was successful. Before discharging, it is very important to ensure the patient and the family have every need available, whether it be resources and/or supplies. When patients and families have all that they need and the materials, resources, and supplies, they tend to have better patient care outcomes. Isn't that the goal for all of us? So, thank you for your time. I hope you enjoyed my presentation. Have a wonderful rest of your day.